Good afternoon and welcome to the Yeovil Hospital Annual General Meeting. It's a great pleasure to welcome you to our virtual meeting today. I'm sorry it's virtual. I wish we could still be back together again, but sadly that's still not possible from a COVID point of view and so on, and probably, given the weather today, we're as happy to be safely in our homes. This has been a busy year again, and we still are coping with the COVID challenges. The hospital is already suffering enormous pressures, but the staff are coping with it magnificently, as you'll hear. Our agenda today will be to approve the minutes of the last meeting, to receive an overview of the year from our Chief Executive, to hear an update from our Chief Nurse and Deputy Chief Executive, and then to receive the annual report and accounts. Then we have a noting of the lead governor's report, and then we will have an update on the collaboration between ourselves and Somerset Foundation Trust. That will be followed by any other business and questions. There's a question and answer function throughout the meeting. If you'd like to post your questions on that, then we will come to those at the end of the meeting. The handover will be from the previous speakers to the next, so I won't be coming back between every presentation, but people will pass on. So I hope that's clear. And I hope that what follows over the next hour or so is informative and helpful to give you a feeling of how the hospital is running. I have to say, I believe everybody here is doing a magnificent job. So the first item on the agenda is to approve the minutes. It's slightly odd procedure when we're doing it by webinar because we can't have a vote, but these minutes have been circulated and we've had no comments to correct them. And on that basis, I'm happy to propose that they be accepted. And I ask Jonathan if he can second that. And having had no objections, we are going to take those as approved. So thank you very much for that. And now what I'd like to do is to introduce Jonathan Higdon. Jonathan has been our Chief Executive throughout the last year and has recently, very recently, moved on to a new role. But before I hand over to him, I want to embarrass him. He's done a magnificent job for us as Chief Executive over the last 5 years or so. I've thoroughly enjoyed working with him, and I know he will continue to make a difference for us for many years to come. But all I can say for now is that what he's going to do is tell you about how the last year went, give you some facts and figures, and I hope a flavour for the enormous effort that everybody's made at Yeovil over the last year to serve the public who we look after. So over to you, Jonathan.
Thank you, Paul, and thank you for those kind words. But I think I'm going to talk this year about a year that has been like no other. So an extraordinary year for Yeovil Hospital and for the NHS. My comments today really reflect the period from March 2020 to the end of March 2021. So 6 months has gone by and an awful lot has actually happened since the period that we're talking about today, but I'm going to try and keep my comments related to that period of time, although I think occasionally we'll kind of stray into what's happened since that time. I just wanted to remind you, as we've done in previous years, of what we as an organisation are trying to achieve, and our vision, which is really our mission, is to care for you as if you're one of our family, and that is always related as much to our colleagues here working at Yeovil Hospital as it has to our aspiration as to the way that we care for you as patients when you need to use our services. And below that we have 4 strategic objectives. One, to care for our population, again very deliberately worded, because as a hospital you'd expect us to talk about how we are caring for people when they get sick, but our aspiration is to do all that we can to avoid people from needing to use our services in the first place, and to focus very much on our population and keeping people healthy and well in their communities. Also developing our people. Without our people, and I'll talk in a moment about all of the incredible staff that work here at Yeovil Hospital, but without our people, this organisation is nothing. And developing our people, providing them with the capacity, the skills, and the environment to enable them to deliver the care that they aspire to is absolutely critical for us. And as we compete in a labour market, both within Somerset but also globally, we need to make Yeovil Hospital an employer of choice. And we're going to hear a presentation from Sheila later about some of the work that we've been doing around international recruitment in an attempt to deal with some of the challenges, particularly around nursing and radiography staff. Innovate and collaborate. This is all about us working with partners, coming up with new ways of delivering care, and focusing on providing care at an outstanding level. We've done an awful lot of work looking at how we provide care across the hospital and primary care, across the hospital and community services and mental health services. And we'll talk a little bit about some of the developments there, but also recognising how important digital technology is to us in the way that we interact with people. And we've certainly seen that the pandemic has moved us forward hugely in terms of our use of digital technology over the last 12 months. And finally, to make our services sustainable and both clinically sustainable, but also financially sustainable. And we'll touch at the end about some of the work that we're doing with Somerset Foundation Trust and the next phase of that. One reason for doing that is to make sure that our services are clinically and financially sustainable as we move into the future. I'm going to give you a few numbers to start with, just to give you a bit of a sense of the operation here at Yeovil Hospital and what we've been trying to achieve in a year that is pretty unique. And then I'll talk a little bit about some of the unique features of that year and how we've been rising to the challenge. We had just under 40,000 people admitted to Yeovil Hospital during the period 2020 to 21. And within all of that, we admitted just over 2,000 children. We saw 46,000 people through our emergency department. And I think our emergency department is one area where volumes and activity have been strangely affected by the pandemic. We saw in the early phases of the pandemic, understandably, people staying away from the emergency department and a significant reduction in activity. And since the end of lockdown, those volumes have significantly increased, and we're now at a point where we are seeing more patients per day, every day, through our emergency department than we ever have before. But we saw 46,000 people during the year that we're talking about here. As I said, over the course of the year, that was about a 20% reduction actually in emergency department attendances compared to the previous year, and a lot of that related very much to the period between November and sort of February, March time, when we did see volumes reduce significantly during the period of lockdown. We had just over 1,400 babies born in our maternity unit. Our maternity unit we are really proud of. Maternity unit gets consistently good feedback from all of the people that use the services, and again I think has massively changed and innovated during the period of the pandemic to make sure that we are able to continue to provide that high quality care to mothers and their families. And just to give you a bit of a sense of some of the things that lie below that, we mended just over 330 hips during the year. We cared for 400 patients with stroke, and we cared for just over 1,500 people with a positive diagnosis of cancer. And again, you'll see in a moment from some of the performance statistics that whilst during the course of the year, we had a significant impact on what we call our elective waiting time. So our times for planned surgery, for example, and outpatients. One of the things we were absolutely focused on was making sure that those people that required urgent treatment for things like cancer actually continued to get their treatment in good time. We carried out just over 110,000 radiology tests. So those could be X-rays, CT scans, MRI scans. So our radiology department has maintained and continues to be incredibly busy. And through our outpatient department, just under 215,000 people attended through appointments, either physically or increasingly actually virtually. During the course of the pandemic, and we've continued since then, we're seeing about 22 to 23% of our patients virtually through different means, be that telephone follow-up or follow-up and review through an electronic means, like a kind of virtual online outpatient appointment. And during the course of the year, a new statistic here, we cared for just under 700 patients with a positive diagnosis of COVID-19. Very much the peak in our activity was just after the Christmas period, and we continue to have positive patients in our hospital today, although the numbers have been significantly reduced. I'm just going to say a little bit about our performance against key national standards. We had a reduction in our referral to treatment time target. This is the percentage of people who receive their treatment within 18 weeks of referral. The national target is 92%. Over the course of the year, we achieved just under 65%. And again, the key reason for that was the suspension of elective activity during the course of the majority, actually, of this year. We're working hard now to get that back on track, and I'll talk a little bit in a moment about some of the work that we've been doing to get our outpatient capacity back up and running. We did maintain our AME 4-hour standard, and again, really proud of everyone working across the hospital on this. I think we were one of very much a handful of hospitals across the NHS in England who maintained and continue to maintain the 95% standard here. And again, it's been increasingly important for us to do that. And as the pressure has increased, you might have heard quite a lot in the media about the pressure on ambulances, and our focus on making sure that people that need our treatment here in the hospital are transferred from the ambulance into the hospital as soon as possible. And this is one indicator by which we measure ourselves. And we saw over the standard, again, the 93% standard of the number of cancer patients seen within 2 weeks. Again, during the course of the year, maintaining our cancer services was a really important area for us. You can see that here in the numbers. We did see a reduction in referrals again, I think as a result of less people accessing primary care during the period of lockdown. We're starting to see those referrals start to come back up again now. We also, and then for me this is the most important standard, to actually those people who've been diagnosed with a positive cancer diagnosis to receive their treatment within 62 days. And again, we're pretty much on the national standard for that, be that chemotherapy or surgery. And you might well have heard that we've been in partnership with the St Margaret's Hospice in Yeovil to make sure that our oncology and haematology services were maintained over the course of the pandemic by moving them to the hospice to provide a dedicated and safe facility for our patients undergoing chemotherapy. And again, we've maintained pretty well our diagnostic 6-week standard. Again, there's been some impact here as a result of our planned diagnostics being reduced in capacity and being taken down over the course of the pandemic. But over the course of the year, a good performance. And again, I'll talk a little bit in a moment about some of the work we're doing to recover that as we move forward. Just some of our clinical standards here. The headline measure for us is our standardised hospital mortality ratio. A score of 1 is what's expected, and we're doing better than that. So statistically better than the national average and a lower rate than would be expected here. So that's good news. We had no MRSA bacteremias over the course of the year. In terms of pressure ulcers, these are category 2 and above, so more serious, moderate to serious pressure ulcers. The position has stayed pretty static again over the course of the year compared to the year before. And similarly, our formal complaints, we had 49 formal complaints in the year compared to 52 the year before. We do work really hard to try and address concerns as they come in and work with people to avoid formal complaints altogether if we absolutely can, because it's best for us to deal with people's concerns at source. And I know our PALS team are very, very focused on that. Where we do have work to do, I think, I read and sign off every one of our complaints, and a key focus there has been around communication. And I think that's been a real challenge for us over the course of the pandemic. Whilst we had to reduce our visiting times over the period of the pandemic, we did try to do what we could with things like technology, using iPads, etc. But I absolutely recognise that is not as ideal as a face-to-face visit. But we've maintained visiting for those people at end of life and in certain other patient groups as well. But further work to do. We focus on around improving communication with patients and their loved ones. Just an overview of our staff. We have just over 2,500 whole-time equivalents here, including the staff that we employ within our subsidiaries, Simply Healthcare Services and Simply Serve Limited, and I'll talk a little bit about them as separate entities in a moment. In the year, we recruited 43 new doctors and consultants, and we recruited 41 new nurses, both including our unregistered, so our HCAs and students. And I won't steal Sheila's thunder as to how we've done this and some of the work that we're doing with other trusts. And we'll come on to that in a moment. Our nurse vacancy rate at the end of March 2021 was 1.3%, and I think, again, this is a phenomenal achievement. And I think if I was sitting pretty much in any other hospital trust across the land, the number would be a lot higher than that. And you know, a relatively low nursing vacancy rate for us, which is a reflection of the fantastic work that we've been doing both within the UK but also internationally to fill our vacant posts. And financially, the headline is we broke even in the year. There was a technical adjustment that actually put us slightly favourable. That relates to some donated assets, and I'll come on and talk about some of those things again in a moment. But a large one was all of the PPE that we received during the COVID period, but also our CT scanner in a box, our third CT scanner. But the Yeovil Hospital Group broke even in the year, which is great. Just to give you a bit more information on that, our operating income for the year was £222 million, and you can see here a large proportion of that went on our pay costs and for our staff, £141 million. The rest of it is largely on consumables and other non-pay type consumables. And in the year, we continue to make progress against our cost improvement programme. We're usually set a standard in the year of about 3% cost improvement programme. That was suspended in the year kind of nationally, and the ask was very much reduced given the rest of the pressure that the NHS was on. But we did continue to deliver savings of just over £2 million, which again is a good position and puts us into a strong position as we go into the next year. And we invested £12 million in our capital. So some of that is slightly higher for those of you who've joined these sessions before. That's a slightly higher figure than in previous years, and it reflects just under £2 million of Department of Health and Social Care donated assets for COVID. And again, I'll talk a bit more in a second when we just talk about our capital investments, what we spent that money on, because there's been some fantastic improvements in the facilities here at the Yeovil Hospital as a result. One of the things we've been very focused on since the spring and going into the summer is our elective recovery, recognising the impact that the pandemic has had on elective waiting times. We were now at the point at the end of March where we were back to about 81% of our elective operating restarting. Some real challenges in getting that back to 100% with things like the availability of having to use PPE slows down operations, the requirements for enhanced levels of cleaning between cases, for example, slows down our ability to be able to use theatres as effectively as we did before. We're on target now to get to 90% at the end of October, so we're gradually improving that, and it's a real area of focus for us. Our referrals have also returned to 90% to 80% of our pre-COVID levels of activity. So referrals coming back up again. We need to make sure then that we are being as productive as we can in our theatres to be able to deal with that and to deal with the big backlog of patients that we acknowledge that we've now got. 96% of our patients now have been referred with suspected cancer seen within 2 weeks. So that's great. And one of the things that we were benefited from was a CT scanner in a box that arrived over the course of a weekend and is now outside of the Women's Hospital. And that's enabled us to get our CT activity back to 120% of what we were doing before COVID. So a third scanner for us. It seems now that that scanner is actually going to be a permanent fixture here, so that's great. It's not going to be taken away, so we benefited from that. We're seeing 75% of our diagnostics being undertaken now within 6 weeks, and each month that percentage is increasing back up towards the 99% national standard. And one of the other areas that we've been very focused on is our capacity to support people to return home. And within Somerset, this is a great example of where Yeovil Hospital, Somerset Foundation Trust, and the local authority have been working together to support new ways of caring for patients at home through something called our Home First and Discharge to Assess service. And we've done two things. One is supporting people to return to their home as soon as they can with enhanced packages of care, should that be required. And the other area is significant investment in what we call our ambulatory emergency care service. So this is a new service, or a service that has grown significantly over the course of the last year, that aims to avoid admissions to hospital by providing emergency care on a day care basis. And again, I'll show you some pictures of the facility that we've developed to support that. But that is now seeing between 30 and 40 patients a day and avoiding almost 20 new admissions to the hospital. There's been an awful lot going on during the course of the year, and just to give you a bit of a sense of some of those things, we enjoyed fantastic support from the local community. We have fantastic support from the local community anyway, but I think that was enhanced during the early period of the pandemic. Every Thursday was our Clap for Carers day, and there's a picture here in the middle of Sheila and myself, but also colleagues from across the NHS and our support services here locally, who did a phenomenal job. We were also beneficiaries from Captain Tom's fundraising. We had some sizable grants from NHS Charities Together, which we used to support the health and well-being of our staff. And one of the things we did was to support a redevelopment of our Breeze Cafe, our hospital canteen. And you can see some pictures there. It's a lovely environment, a place for people to go to just take a moment for reflection in a COVID secure environment. We also had some areas of celebration, and we won a national award in the year. So we were announced as deserving winners of the Inclusive Recruitment Award for Equality and Inclusion, which was a great accolade for the work that has been going on here around diversity and inclusion, and a reflection of some of the work that's been focused around our staff survey. Also, we celebrated, as we do each year, the Day of the Midwife, the International Day of the Nurse, and Allied Health Professions Day. I have to say it was probably more challenging to do that this year in a COVID-safe environment than it has been in the past, but we still managed to benefit from some cakes that were donated by Val Stones from the Great British Bake Off. So Val, again, supporting Yeovil Hospital as she has done each year. And next year, I think, as we are able to move to hopefully more face-to-face celebration, these anniversaries will become even more important for us. The NHS National Staff Survey takes place each year, usually in November. Again, as in previous years, we had one of the best response rates in the country. Around 65% of our staff filled in the staff survey, and again, for me, that's a really important indicator because it makes the results statistically significant. We had some areas where we really stood out in the results of those staff surveys. We were the best trust in the country for staff and health and well-being for the third year in a row. We were the top in the country for providing flexible working opportunities, and we were in the top 3 for our overall staff engagement. So really, some really positive things there. There are always areas where we can focus, and there are some areas that we are focusing on this year. But our staff survey results really did overall indicate the strength of the culture here at Yeovil Hospital. During the pandemic, we also benefited from some support from the armed forces, so from the Marines and from our colleagues at RNAS Yeovilton, who were with us for a period of time just after Christmas, supporting the effective running of the hospital during probably our most challenging period, of the pandemic. So a big thank you to all of those people that supported us during that time. And this year has been like no other, really, in terms of our reflection. And a number of highlights from the year here was that we celebrated the first National Day of Reflection, marking 1 year on from the first lockdown. And our From the Heart display for staff enabled them to have their own reflections of the last 12 months, and that was displayed across the hospital. We also joined in the national 1 minute silence for those who sadly lost their lives due to COVID-19. And one area of recognition was from the then Secretary of State in his blog on our work around international recruitment, which I am trailing quite heavily here, and you'll hear some more on in just a moment. As we near the 72nd anniversary of the NHS, we did hit a small socially distanced tree planting in the Trust Gardens, and we were really privileged to be joined by the first COVID positive patient who was discharged from Yeovil Hospital to plant 2 trees of remembrance just outside the Breeze Cafe. And also during the year, we opened our purpose-built key worker accommodation, and we started to take our tenants into that facility, which is a phenomenal facility for the hospital. It has 66 apartments, a total of 176 bedrooms, and is a major area in our recruitment and retention strategy. If you know it, it's just along Reckleford, just behind the old or the bus depot, but a fantastic development, purpose-built, and just 5 minutes from the hospital itself. And you can see there we were also privileged that was officially opened by TV presenter Sarah Beanie. There's been an awful lot of what we call capital developments, so improvements to our estate during the course of the year. As I've said before, we installed a new CT scanner. This was again a great achievement. It arrived over the course of a weekend in a box. You can see it there in the picture, and was fully fitted out internally. And over the course of just over that week, it was plumbed into the front of the Women's Hospital and started to see patients. And again, because it was outside of the hospital, we were able to provide CT scans for planned patients probably earlier than we would have before had we had to invite those patients into the main radiology department. That was provided by NHS England to support us as part of our pandemic recovery response. We also worked with Macmillan Cancer Support, and in the main entrance of the hospital have developed a new health and wellbeing hub, which was opened during the course of the pandemic and was a welcoming space for anyone. So for staff working in the hospital or for patients or their families who are dealing with long-term conditions. And again, we provide advice, guidance on ongoing treatments, but all of the elements around dealing with patients' care in that health and wellbeing hub. We also invested quite significantly in our emergency department, and one area has been our development of our ambulatory emergency care unit, which was opened during the course of the year. And you can see again some pictures there. It's close to the emergency department. We had a smaller ambulatory emergency care unit, but this has enabled us to expand the service, to provide a greater range of services to even more patients than we did before. And we continue to develop our emergency departments. We also, as part of this development, expanded the number of what we call major bays, so those bays that are for the sickest patients, and with a dedicated paediatric waiting area, triage and treatment area for children as well. So the pandemic has seen a big improvement in our emergency facilities. And again, I just wanted to pay tribute to the staff in the emergency department, who, as well as dealing with COVID, as well as dealing with the increase in demand through the emergency department, were also at one point after Christmas also in a live environment with a lot of building works going on around them, and they were phenomenal in terms of dealing with that. But I think you can see there that the impact and the outcome of that is probably worth the pain at the point in time when they were trying to deal with all of those things. We also have just we have a longer term strategic plan for the hospital, which we call Yeovil Hospital 2030. And that's our aspiration, to build a new elective centre in what was the old visitor car park, to majorly refurbish our wards, and to further expand our emergency department. And we continue to try to secure the resource to enable this to happen. We have just put in an expression of interest to the new hospitals programme. So this is these are the new hospital builds that you probably hear on the news. There's been 8 new expressions of interest being released, and we put in a bid for 250 million to support that here at Yeovil Hospital. It is incredibly early days, and there are many rounds to go through before we're successful on that. But I think as well as us doing making the best of the funds that we've got on an annual basis, actually we have got a mind to the future in terms of the facilities that are required here in Yeovil into the future. Yeovil Hospital Group is also made up of 2 subsidiary companies, Simply Serve Limited and Simply Healthcare Services, and they both have separate annual accounts and an annual report, and I'll just pick out some of the highlights from that. Simply Healthcare Services is our primary care partnership. At the end of 2021, it was managing 10 practices in 14 locations across Somerset, providing care for a practice population of just over 82,000 people. That makes it one of the biggest primary care providers in the country. And having that sort of scale has definitely enabled us to make all sorts of changes and all sorts of things with primary care that as a hospital we might not have been able to do without the benefit of such an at-scale provider. It was very focused on ensuring the safety of our patients and staff through the COVID period, and worked really closely with the primary care networks across the county to deliver the really successful COVID-19 vaccination programme. We introduced Ask My GP, so that's an online triage and consultation system in 7 additional surgeries. So again, I think very much the pandemic sped up this move to digital in primary care. But we also introduced a new telephony system across 2 surgeries. And SHS achieved its financial plans for the year and integrated 1 new practice, which was the Exmoor Medical Practice, on the 1st of April. We're also working as part of our proposed merger with Somerset Foundation Trust to integrate 4 practices that are currently run through Somerset Foundation Trust into SHS, and we took on operational management responsibility for those 4 practices during the course of the year. And we're currently working with 6 additional practices, including the 4 at SFT, who we anticipate to join SHS between April and October of this year. So again, SHS continues to expand, go from strength to strength, but I think importantly support primary care in Somerset through the recruitment and retention of GPs, for example. Simply Serve is our second subsidiary, and Simply Serve works providing estates and facilities services to Yeovil Hospital, but also to a number of other partners across both Somerset and Dorset. And this is the range of services provided by Simply Serve Limited. Just under 300 staff in the Simply Serve subsidiary, providing a whole range of support services here to the hospital and as in to other partners. In terms of the major achievements, there's as well as leading on the capital developments that I've just outlined previously, Simply Serve leads on all of our internal kind of work and improvements in the facilities, and a lot of these things are things that you may not see. So things like the replacement of the bed lifts, which are currently underway, supporting a whole new redevelopment of our MRI and CT facility. So again, as well as the third CT scanner in a box, we're currently in the process of installing a second MRI scanner, replacing the first MRI scanner, and also replacing our second CT scanner. So by Christmas of this year, our radiology department will have had a significant increase in capacity and a whole new facelift. SimplyServe also supported all of those changes to the built environment. So I talked about our ED expansion. The other significant development was a development to our intensive care unit to make it more flexible, to add an 11th room, but also, or 11th bed space, but also to enable the unit to be separated, to enable us to care for both COVID patients and non-COVID patients in the same footprint, but with very separate physical barrier between the two. SimplyServe supported the development of the residential unit, which was built by our partners through the Yeovil Estates Partnership, but SimplyServe did the phenomenal job of making sure that the building was kitted out and that the marketing happened to support colleagues who wanted to move into the residential unit from the 1st of April. And we're now at a point where the unit is for the residential development is fully subscribed, which is great. We're also working on a programme of ward window replacements. Again, if you look at the south side of the building, you will start to notice on level 7 that we started to replace the windows from the inside out. I think, again, in terms of improving the patient experience and the environment for patients, this is something that is much needed, particularly as we move into the winter. And also replacements of the roofs in both the Convermore area, which is on the other side of the hospital main road, and in the women's hospital. We've also developed a new purpose-built dermatology facility within our Queensway Day Hospital as well. One of the things that Yeovil Hospital is really fortunate to have is a vibrant charity and great support from our local population. Over the year, we received donations from around about 3,000 people into the Yeovil Hospital charity, and the donations totalled £773,000. A large part of that was our breast unit appeal, which I'll talk about in just a moment, but the charity supports people in the community. We work with people in the community to support our staff as well as our patients. So again, some of the work that we've been doing around staff health and well-being has been supported by the charity over the course of the year, but it's down to the fantastic support of the fundraising team, but working with the local community that we're able to do some of these things. And our major appeal this year is the breast unit appeal, which is now past 1.7 million against our 2 million target, and we're starting to plan to start to build the new breast unit just after Christmas. So it'd be great to see that getting off the ground physically, but the appeal is going great guns and continues to almost get to the point where we've fully achieved our target, which is great. We are also supported by an amazing League of Friends, and the League of Friends donations for the year totaled just over £188,000. And again, they supported part of the canteen refurbishment as well as the Captain Tom legacy, and also provided things like Dyson fans for patients on the wards, artwork, magazines, and every year the League of Friends support us with Christmas gifts and cards for all of those patients that are in hospital on Christmas Day. So a big thank you to us all, I think, for the League of Friends, and also to the charity and all our supporters. And finally, I just wanted to touch on our collaboration with Somerset Foundation Trust, which we'll hear a little bit more about from Peter in a moment. During the course of the year, we were dealing with the pandemic, but we were also strategically moving forward with our potential merger with Somerset Foundation Trust. During the year, we agreed to pursue in principle this merger, and we signed a memorandum of understanding in May 2020. The aim of the merger really is to bring together the expertise, the experience and the resource of the two organisations with a view to provide much more joined up mental and physical health care for our population, and to support more integrated ways of planning and more integrated models of care. The new organisation would have responsibility for 2 acute sites in Somerset, for all of mental health services, all community services, and through SHS, almost 1/3 of primary care. So it would give us a massive opportunity to join up care across the county. And I think, again, if you go back to some of the complaints that we hear as organisations, they're sometimes about where people fall down in the gaps between parts of the service, and this will provide a great opportunity for us to join things up. We're just working through, or we submitted during the year, our strategic case to NHS England, which is very much the first step, and that was approved by both of our boards and by NHS England, an improvement in April 2021, and that basically means that we can move on to the next stage, and that work is progressing at pace now, and we'll hear from Peter in a moment about what happens next with the work around the merger. Thank you. That's it for me. It's been quite a year dealing with the pandemic, but I think also really dealing with and moving forward with our strategic ambitions as well. And I just wanted to close by saying a massive thank you to our community, but also a massive thank you to all of our staff here at Yeovil Hospital for their undying and unwavering support during the course of the pandemic. It has been a phenomenal time, a challenging time, but as usual, the staff, our colleagues, the people that I am really proud to call my colleagues here at Yeovil Hospital have more than risen to the challenge. Thank you very much. I think I am now passing over to Sheila. I have very much built up the work that we're doing around international recruitment, so I'm going to hand over to Sheila, who's going to give us a little bit more detail on that.
Hi.
1 second, you're not.
It's the mute button isn't coming on.
No,
We can hear you, Sheila.
Hi, I'm sorry about that slight technical issue. I'm Sheila, I'm the Chief Nurse, Director of People and Deputy Chief Exec at YDH. So I'm going to talk to you a little bit more about the COVID response, about our vaccination hub, and then the much acclaimed by Jonathan international recruitment. So we're 19 months into to COVID. And who'd have thought that I would be here talking to you about it today still. And having discussed our original response at our last AGM, as I say, I didn't expect to still be talking about it, but let me give you some more facts and figures. Sorry, again, a slight technical problem. Arrows aren't working to forward. So obviously a lot of the work that we've been doing around COVID has been adapting what we do to protect our patients and staff. And I think right from the beginning of the pandemic, we obviously had to put lots of things in place. And I think over the last period, really, a lot of this work we've done is to make those quite permanent. So you can see there just some facts and figures about the PPE that we've used. So that's the personal protective equipment that both our patients and visitors to the hospital and most predominantly our staff use on a daily basis. So 18,000 surgical face masks. So that's the blue masks that you will see people in. 7,500 aprons, 35,000 gloves. And FFP3 masks are the masks that really are for our high-risk patient contact, and that's about 500 a day and growing. Testing has been integral to what we've done, and you can see that we've got some figures there for the year that we're covering in this AGM, but even more testing goes on today. So we've done lots of testing on our staff and household members, because obviously if we've got a member of staff who has a family member living in their household that's symptomatic, we need to test them as well, and we've made sure that we do that as rapidly as possible through our own testing hub. We test patients before they come into hospital for planned operations. We test patients in our ED department when we're looking to admit them, and then we continue to test patients throughout their stay. And that's on a kind of quite a regimented rota of testing. So you can see we do a lot of testing. We've also, as I say, that has grown. We do lateral flow testing, so our staff are all encouraged to self-test at home using the same tests that you may have used at home yourselves twice a week. We have a 7-day-a-week HR helpline so that we can make sure that we know about those test results and that we act on those test results. So testing has been more and more important, and I think will continue into the future. As Jonathan's covered some of these, we have adapted other things to protect patients and staff. Our oncology and haematology services were moved to their new home at St Margaret's Hospice. So that was about moving our most vulnerable of patients out, and that has worked incredibly well. And we also looked at how we could, I guess, control the number of people coming into the hospital and making sure that people came into hospital for what they needed. So we looked at, I guess, digital technology to see how we could keep in touch with patients and continue their consultations and treatments virtually wherever possible. And we've done 67,000 of those appointments, as I say, since April 2020. That sits at about 24 to 25% of our appointments now, and has received incredibly good feedback, both from the patients that are using that service, but also from the clinicians on the other end of that. So living with COVID, as I say, we've had to make things feel a little more permanent because we are 19 months in. So within the hospital, all of the restrictions remain in place, and that's to protect our vulnerable patients and to protect our staff. We've engaged in lots of, I guess, fresh eyes looks, because when you've been doing this for 19 months, we need to make sure that we keep an eye on things, that slight confusion with what goes on outside of the hospital doesn't creep into the hospital. So wearing of face masks continues to be mandatory in all of the clinical areas and any areas where we can't socially distance. We do have social distancing throughout the hospital, but that has been made easier by the use of things like screens between chairs in our outpatients department, so that we could increase the number of people who were in waiting rooms in as safe a way as possible. We've developed some outside areas, and as you saw, the Captain Tom money and League of Friends money enabled us to ensure that our staff could have some downtime and some breaks. And what you couldn't see very well from those pictures is even in the canteen, on the table between two people sitting, there is a screen in the middle to help protect people while they have their breaks. Hand hygiene continues to be very important. It always has been important in hospitals. And we're obviously, as we head into winter, we also think about things like norovirus. So we need to remain, vigilant and encouraging of hand hygiene at all times. Visiting restrictions have been in place in trying to make sure that we maintain that social distancing on our wards, etc. We have had to alter the way visitors come into the hospital, and at times we've had to limit the visiting so much that it is for end of life. On a restricted basis, and also making sure that we help with those patients that have got sensory or special emotional needs that require them to have either a carer or family member with them, and we've done our very best to support that. And we've done a lot of communication. We have daily communication across the trust, daily reminders about infection control, and really just pushing that messaging. One of the things that's happened that we're incredibly proud of is that Yeovil Hospital became one of the first 52 locations in the world to start providing the COVID-19 vaccine. That was alongside colleagues from Somerset Foundation Trust and the council. And we kicked off, and in our first week we delivered just under 1,000 vaccines. In one day we did 650 from a kind of standing start. And I think all of the staff that were involved in that and the whole hospital felt incredibly proud to have been part of that. And we, the Southwest did incredibly well, and we played our part in that. So a very proud moment for the hospital. We provided, in the end, before our hospital hub was stood down for a short while, we provided just over 13,000 doses that was to Yeovil Hospital staff, partner organisations, so social care organisations and the providers of care out in our community, and patients. We still run a clinic at the moment, and that's for people who have had allergies in the past, and those patients are referred to us for their vaccination. So very proud moments. I will go on now to talk about international recruitment. So we work across a number of trusts on international recruitment. We set up our own international recruitment and really looked at how to do it well, to make sure that the nurses and anybody we were recruiting from overseas were recruited in an ethical way. So we weren't stripping countries of their well-trained nurses. And that when the nurses came to us, they had a great recruitment, a great arrival with us, and they stayed. And we worked really hard on that and were very successful. And we then started to get asked to recruit for some other trusts. So we shared our knowledge and have undertaken that recruitment. So we attract our nurses from around the world, mostly through Dubai at the moment. So these are nurses who have been globally trained in their country of origin, and in effect they're trained with a view that they are going to travel and work in other countries. So Dubai, Oman, Qatar, and you can see the list of countries that our nurses come from. We've recruited over 2,000 nurses in the 3 years that we've been doing this, and 80 radiographers. And for us at YDH, this has meant that we have very few vacancies on the wards. We're in a very fortunate position that our nurses come, they stay, they build fantastic communities, which is just wonderful. And we're currently supporting 17 other trusts by undertaking their recruitment for them. You can see some of the numbers there. So these are nurses that we've recruited for other trusts, and these are nurses that are working in those trusts today. And they're working during a time where obviously they're away from their families at the most worrying time. And so a lot of our recruitment is around making sure, as I say, that the experience is good and that we really, really look after these nurses, recognising the time in which they're working now. Our success really, so we're now the lead overseas recruiter for the south of England. We're expanding who we recruit, so we are working with Somerset Foundation Trust looking at mental health nurses, community nurses, and we will be looking at midwives. We are supporting allied health professionals, so that's occupational therapists, physios, radiographers to work in our diagnostic imaging departments, etc. And we also provide OSCE training. So that is when someone comes from overseas and they have to undertake in effect, a test of competence, and we help to make sure that they pass that first time, so that they can get up and running in the role that they came here to do. Some fabulous feedback there, and we really do get amazing feedback from the nurses that come through and work both at YDH and at other trusts, which is wonderful to see. And I think it really is about looking after those nurses from the very minute we meet them in Dubai or the Philippines, keeping in touch with them, making their journey into the UK work really well, looking after them through their isolation, and just making their careers wonderful when they arrive. So we've won quite a lot of awards. Jonathan mentioned one of them. We've won awards for international recruitment. One of our overseas nurses is up for the Overseas Nurse of the Year this year. We've been shortlisted again for international recruitment this year. And a lot of that really around that kind of person-centred recruitment. Thank you.
So, thank you, Sheila. Some astonishing numbers in there and some outstanding performance. It's lovely to see that Yeovil makes a difference in such a broad way with such a lot of different parts of the NHS. And obviously our thanks and congratulations go to everybody who's been involved with that. It really is it's quite a difference that this little hospital and its team can make in the bigger world. So now we move on to the next item on the agenda, which is to receive the annual report and accounts for 2021. These have been published on the website, and I hope everybody's had a chance to look at them. We've had no particular comments for raising at this stage on it, but if anybody does want to ask any questions on that, we will deal with that. So please put them on the board. We'll handle them at the end of the meeting along with everything else. But for the formality of this meeting, I have to formally receive these. I propose that we do that. I'll look to my left again, and hopefully Jonathan says yes, he does. And on that basis, we will receive the annual report and accounts. And the next item that we are to note is the report of the lead governor, and that has been circulated again with the agenda, and I'm very grateful for the kind comments that Alison has made on behalf of the governors about the way in which the hospital has performed over the year. We work closely with our governors and are delighted that we have a good dialogue, and it is very satisfying to feel that we are fulfilling our obligations so far as they are concerned to the people who they represent. So thank you very much to the governors for that vote of confidence in the way the hospital is performing. And that brings us to the next item on the agenda, which is to hear an update on the collaboration with SFT. And to do that, I'm very pleased to welcome our new Chief Executive, Peter Lewis, who has very recently taken over as Chief Executive of Yeovil Hospital, as well as Chief Executive of Somerset Foundation Trust. So he really does have a view of the whole of the picture. It's a big job to do. And we owe it to everybody in the system to work together to make sure that health inequalities are overcome wherever they can be. And I feel we're making good progress. Obviously, there are always anxieties when change occurs, but I feel really confident that we're on the right path here. And it's my pleasure to introduce Peter Lewis.
Thank you, Paul, and good evening, everybody. And it's great to be here. As Paul said, just started really recently as Chief Executive of Yeovil District Hospital, and only last Monday, so just over a week. So it's great to be here. Before I say something about the future, and I guess some of the challenges that we need to face and how we're going to face them, I'd just really like to start by congratulating Jonathan and the team at YDH. For everything we've just heard. Absolutely fantastic achievements, particularly in the context of, I think, as Jonathan said, a year like no other that we've all been through. So it's really great to hear all of that, and congratulations to Jonathan and the team for that. Jonathan talked as he was going through his slides and sort of touched on a number of the challenges, and I guess we had certainly as an NHS system in Somerset, we had some challenges before COVID, and those challenges still remain with us, and I guess they're probably bigger in some instances than they were before. So we know, for instance, that the demand on our services is increasing significantly, and COVID has only put greater demands on that, whether that's about emergency care or some of the concerns around waiting times and people waiting for treatment that Jonathan touched on. And we know that the NHS generally, and whilst we've done some great things to Mitigate this is struggling with people and workforce in some areas, and we've heard from Sheila some great work that's happened to mitigate that locally, but nevertheless we know that the future workforce for the NHS is very important. Our colleagues are very important to what we deliver for patients, so we certainly have some challenges in that as well. And in some ways, we've been fortunate in the last 18 months that the financial arrangements in the NHS have changed to support the response to COVID. But we do know that as we go forwards, we have some challenges that across Somerset we are spending more than is available to us to care for the population. So we know that adds up to some significant challenges for us as we go forwards. And I guess what that means is that we need to think differently about how do we best meet the needs of the population. We cannot continue to try and respond in the ways we would have done historically, which is about trying to generate more capacity to meet the demand as it increases, because we know we have not got the resources or the people necessarily to respond in that way. And therefore there's something, and Jonathan mentioned this, and we've seen some really good progress over recent years in how do we think differently about how we meet the needs of the local population, how do we best support people, how do we integrate services around them so that we can meet their needs earlier and be much more proactive. And if we can prevent people's conditions deteriorating or them getting sick, then clearly that's in our interest and is something we very much should be doing, and have a focus that we've not always had on prevention. And particularly what COVID has shown us is that the impact of inequalities and health inequalities in the population means that there are people living locally who suffer more than others, particularly with something like a pandemic, and we've seen that. So we need to think about how do we be much more proactive, how do we get a real focus on targeting the people that need our support the most. And to me, that's where we have a really good opportunity as YDH comes together with SFT. As Jonathan said earlier, this is about bringing together quite a wide range of services to the local population. So all of our community services across the county, all of our mental health and learning disability services, with our acute hospitals here in Yeovil, but also in Taunton as well, and with a significant proportion of our GPs and our primary care services across the county. And I think that gives us a real opportunity to look at person-centred care. How do we join up those services? How do we integrate services, both around the needs of the individuals, but also around the needs of local communities and local populations as well. And I firmly believe in doing that. We can deliver benefits for the population and for patients, so that we make sure we give everybody the care and support they need, and we provide high quality care regardless of the service that those people need, or regardless of where they live and where they're getting that care across the county as well, so we can deliver that on a consistent basis. I also think that there's a real opportunity here for how we support colleagues and the benefits we can deliver to colleagues working across services across the whole county as well. Jonathan talked about it's often in those interfaces between services and organisations where things potentially go wrong, and that's sometimes what we see some complaints about. But they are also the things that frustrate our colleagues when they're trying to do their best for patients as well. So I very much believe that by coming together, by looking at how we deliver those services, we can not only remove some of those frustrations for our patients, we can remove them for colleagues and give them a better experience as well as giving colleagues an opportunity to work in new roles, potentially in different parts of the service across the county as well. So some people will be very happy doing what they're doing at the moment in the place they're doing it, and that's great, and we want people to be carrying on and be committed to that and have that sense of pride in what they have been doing. But there'll also be others who want to look at other opportunities and how they can work in different roles across those different parts of our services as well. So I think we are in a great position and a unique position in terms of bringing one NHS provider together within a healthcare system like we can in Somerset to deliver some of those benefits. And Sheila touched on the role that YDH has had working with partners around the vaccination programme as well. And I think the vaccination programme is a really good example about how, if we come together, we think differently about how we provide those services, the difference we can make. And we saw a range of partners coming together to do that. But one of the other really important parts of the vaccination programme was how do we almost proactively go out and find those people who might be more difficult to reach, less willing to come forward and have their vaccination. And we put a lot of effort into doing that, working with local communities and local voluntary groups to go out and be more proactive in searching out those people. And that was great because that enabled us to get them a vaccination that they might not have otherwise had. But I think what it's also told us is there are other health needs out there in some of those populations where they're not always coming forward. And that's what's driving some of the health inequalities we've got across the county as well. So I think there's a lot we can learn and how we can apply that to the two organisations coming together and truly get a population focus to the way we deliver health and care as we go forward. And I think that will really truly help us address some of those challenges that I talked about just now. So in terms of process, and Jonathan set out a bit of the history of where we've been in the two organisations coming together, and we had that strategic case signed off by NHS England improvement earlier in the summer, which is actually great. Now, from a process point of view, we're very much focusing on we've got to deliver a full business case, which we're planning to do by the end of May next year, which will be the full case for bringing the two organisations together, what that looks like and the benefits we can deliver. But there's two really important parts of that business case, and you'll know from the conversations we've had previously, we've taken a decision to extend the timeline slightly and complete that business case by the end of May, because we want to get that patient benefit case right and be very clear on those benefits that we think we can deliver to the patients and the local population. And clearly that's paramount. That's what this is about at the end of the day. We are here to serve the population and how we provide them with great services. But also we want to make sure that colleagues have an opportunity to be engaged in this, and we've heard that the difficult time that colleagues have been through, and colleagues are still under pressure in terms of responding to some of the needs on them at the moment. So we want to give them some time to get involved and get engaged in what some of those service developments could look like. And what does our provision to the population look like in the future, which will enable us to build that clinical strategy from the ground up, if you like, and really get colleagues engaged in that. So that's very much the approach we want to take over the next 6 months or so. As I say, engagement with colleagues is really important. We are just about to launch something that we're calling engagement champions, where we've got people from both organisations who are going to work with us and provide that critical link between this process of creating a new organisation and an organisation that we want colleagues to feel real pride in working for and what they're delivering across the whole of the organisation and the services. So we'll have those engagement champions that will work with us, but that they'll also be talking to colleagues and be our eyes and ears as well of the concerns that colleagues have, but also the ideas and the opportunities that colleagues are seeing as we come together and how we can deliver on those. So just an example of the approach we want to take in bringing the organisations together. And just to finish really, on a personal note, I'm really excited to have joined YDH in the last week or so, but also by the opportunity and what I think is a fantastic opportunity that we've got to really provide great care and support across the full range of our services to the local population that we're serving. And I very much look forward to coming back here next year as part of the AGM and sharing with you the progress that we'll make during that time. So thank you very much, everybody. I'm going to finish there, and I'm going to hand you back to Paul.
Thank you very much, Peter, and you're very welcome. And as you say, a big task ahead, but I'm sure that we'll look forward to working together, and that includes Jonathan and his role as well. So we look forward to the future with great enthusiasm. We're now coming to the question and answer section, and I'd like to invite the executive colleagues of Yeovil to join the session when prompted to answer a question. There are a couple of questions that I have got, and the first question comes from a gentleman called John Clark, and the question is, how do YDH and SFT compare in size, technology and strategic vision? Well, Peter, you may think that you've had a rest, but I think probably it's for you to comment on.
Thank you, Paul. So thank you, John, for that question, and I think it's quite an important one. I guess there clearly are some differences between the organisations, but it's not just about size, technology, and vision. I think what we've got here is two organisations coming with different service portfolios as well. So SFT very much providing community mental health and learning disabilities to the whole of the Somerset population, as well as running Musgrove Park Hospital. YDH running Yeovil District Hospital, clearly in terms of the name of the organisation, but also really great history in terms of providing primary care, which Jonathan described earlier in terms of an at-scale primary care provider, and some really good experience in some work that's been done looking at how do we integrate care around local populations. So I think those two things come together really well, and there's a good synergy between them and that history and that experience. There is a difference in size. So I think YDH employs, just as an example, just under 3,000 colleagues, and SFT is just over 9,000. So that gives an idea of scale, but as I say, they are colleagues doing different things in each organisation as well. In terms of vision, I think there's a lot of similarities in that approach in terms of really looking at the needs of the population, and how do we work back from that, if you like, and really wanting to put the population at the centre of what we do. But one of the really important things about the merger, it's about developing that shared vision and bringing together a vision for the new organisation that people can align behind. And that's very much some of the work that we're doing as we go through the process to get to that full business case as well. And I think that's really important. I think if we have that vision and we back up that vision by doing the right things and taking the right actions, then we'll get people with us, both internally and externally. And I think we can make a real difference for the people that we're serving.
Thank you, Peter. And then there's a follow-up question. If I look like I'm reading something, it's because I am. It's up on the screen in front of me. It's way away. And I think the best thing to say is that I'm sure the answer is yes, and Peter will commit to engage fully with place leadership and by other parties, both public and private sector. We must all work together in the way in which we deliver this, and we can't do it in isolation. Nowhere is isolated. So we'll absolutely consult all the way around. And I'm looking at Peter on another screen, and all I want to do is nod to me.
Yes, yes.
Peter is nodding to me. You can speak, Peter. I think you can be heard if you speak.
I can be heard, yes, certainly. So I think it's really important, Paul. So if I can just say a bit about that. So one of the things that's really important is how do we we're building an organisation which by definition is clearly larger than the two existing organisations, and I think that's really important from giving us some resilience and some organisational scale. but we need to work locally and very much engage locally. So much of what we do and the need that we need to do is work very locally with local communities and think about how we meet the needs of the population. So certainly I'll be very keen to engage with the place leadership group that John refers to in his question. And I think that is really important about how we engage with partners across the board, not just within health. And there are so many things that impact on people's health and partners that we need to work with to do that around those wider determinants of health. And if we can do what we can to work together to keep the local population healthy and healthier, that's in all of our interests, not least the people of Somerset and the surrounding area.
Thank you very much. It would seem that we have silenced everybody because we've shared an enormous amount of information that seems to have answered all the questions that exist, because I have no more questions for anybody to answer. So all my executive colleagues who are sitting there nervously are about to be let off. So there it is. As everybody will have heard, it has been quite an extraordinary year for the NHS in general and for Yeovil in particular. And as ever, as I come to this stage of the AGM, it's my job to thank people. And I'll do my best to remember everybody. But first of all, obviously, this hasn't happened by accident, the way this hospital is performed. And the executive team and all their supporting leadership teams have done an outstanding job to pull us through. People have become tired, people have been ill, but people have been nurtured and they've been helped to cope with what has been a once-in-a-century challenge, and let's hope it's even longer than that before something of the same nature occurs again. So first, I'd like to say thank you to all of those, and again, thank you to Jonathan for leading that team through what was a difficult year, and there's been a further difficult 6 months. And I think everybody needs to remember that having done all that, it's been very tiring, so people are a bit emotionally exhausted now. We all need to help each other going forward. I'd like to thank my non-executive colleagues. They provided robust challenge and support throughout. I know that there's been a good dialogue between the executives and non-executives. It's an important part of keeping the hospital on side and cited on the important things that we do have non-executives, and all of them have made a significant influence to the way in which we performed. So thank you to them. Of course, my thanks go to all our staff. I started trying to list the different groups and realised that if I dared to speak them out, I'd miss the most important ones of all. But everybody has made a difference from top to bottom, left to right, inside out. Everybody has worked extraordinarily hard in challenging circumstances, and I'm proud as punch of everything that Yeovil's managed to do and everybody's efforts in the year, and that's superb. Our volunteers, as ever, are crucial to our success. Without our volunteers, without the volunteers who give their time freely and willingly to help people in some of the most informal ways, but the most important ways to give people a chance to feel a little bit at home in this slightly alien environment they come into, with probably 101 worries before them. And our volunteers provide fabulous support for all of the people who come to our hospital and around it. Thanks, of course, to our governors who provide immense support. We enjoy sitting with them and discussing how things are going. We enjoy their feedback on behalf of the patients and the population who they represent. They are the public's representatives, they're elected, they bring their criticisms, they bring their compliments, and it's very helpful to us to have that in. And finally, I'd like to thank the public who we serve for their patience and their understanding. This has been a really tricky period. And it would have been so easy to be angry, wouldn't it, if things don't go quite the way we want to. But the effort that's been made has been recognised by you all. And I'm really grateful for your patience and your understanding as we've worked our way through this difficult time. And let's hope we can start to get back to some normality in the not too distant future, although we haven't quite got there yet. And I'm now looking to Jonathan. There's anything else I need to do. And I'm looking to my colleagues over here. Is something I have to do? There are no more questions, although thank you very much for that kind comment. And with that, I will close our AGM and thank you all for attending.